Right, I've got to call out the BBC Radio Tosspots for once again cutting off a caller who's just stating facts about Sage and the psychological warfare campaign waged against the British public that can be proved using the government's own website, I should add. Though, to be honest, the BBC hack in this clip that I'm going to show you knows full well that the caller Dr. Bruce Scott is 100% correct. The damage control they run when they finally stop him speaking goes on for about 5 minutes, but you can guarantee that they don't let him back on, let me tell you. In fact, he actually said on Twitter that a producer came on the phone saying the conversation had moved on because the BBC don't report the truth, they further the agenda. This was all done during a discussion on drink and drug deaths rising up in Scotland, which Dr. Bruce Scott actually has expertise in. As you will hear, knowing what you are talking about and speaking the truth does not matter to the BBC. You will be silenced if you talk about things that they don't want the public to know.
Is with us from Hoyk, and Bruce, you work in substance abuse. You've got, I guess, a first-hand experience of how this affects people. Why do you think there's been an increase?
Right, well, I've worked in mental health for over 25 years. I did a PhD in psychology and I trained as a psychoanalyst. And it's quite obvious. This is something that's not discussed in the mainstream media at all. The British government, and as well as the Scottish government, have endorsed and supported policies within the last year and a half for the COVID regulations, which have deliberately increased fear amongst the population. In the SAGE documents of Spy B, the psychologist, it is stated a substantial number of people still don't feel sufficiently personally threatened, and the perceived level of personal threat needs to be increased amongst those who are complacent using hard-hitting emotional messaging. These diktats, amongst the many other things in these documents, have broken the guidelines of the British Psychological Society, and they've been implemented by our governments in the United Kingdom. Now, as a result of the lockdown and the restrictions, what has occurred is increased the risk factors for suicide, substance misuse, self-harm and mental health issues. For a disease, COVID-19, which for a majority of people, 99.8% of people, it won't be harmful. So, unfortunately, the increase in alcohol abuse has got a direct link to the policies that have been implemented.
Well, hold on a second, Bruce. Let me bring Dr. Peter Rice back in. Is that correct, what Bruce is saying? Yeah. Deliberately creating fear amongst the public? Can we say that that's accurate?
That's not a view that I share. I think I'm right in saying that there was a small but welcome decline in suicide yesterday that came out. So I think your earlier commentators made a lot of important points, but I don't hold the view that there was a deliberate attempt to promote unnecessary fear amongst the population, and that led to more drinking. I don't think that's been a major factor. I think the other things that Kirsty, John and others were talking about are much more relevant here.
Now, you will notice in that clip the BBC hack didn't disagree with anything he said or state that he was wrong in any way. And in fact, I find it hard to see anything in what he said that was actually wrong. Maybe the fatality rate, because I've heard various numbers between 99.5% and 99.8%. But as you heard, she didn't really care about that and actually avoided it completely. All she could do was focus on the claim the government ramped up the fear last year, which, as I said, this claim is actually backed up by evidence. On the screen now we have the UK government document that they published called 25 Options for Increasing Adherence to Social Distancing Measures. It is dated March 22nd, 2020, so the day before we got 14 days to flatten the curve, which was obviously 513 days ago now. This in itself is actually an interesting document to read and will be linked down below, but at number 2 it literally states persuasion, and I quote, "Perceived threat, a substantial number of people still do not feel sufficiently personally threatened. It could be that they are reassured by the low death rate in their demographic group, although levels of concern may be rising. Having a good understanding of the risk has been found to be positively associated with the adoption of COVID-19 social distancing measures in Hong Kong. The perceived level of personal threat needs to be increased among those who are complacent using hard-hitting emotional messaging. To be effective, this must empower people by making clear the actions they can take to reduce the threat. So it's literally there in government black and white, which, as I said, the BBC fucking know without a doubt, the bunch of snivelling shitweasels. This is why the doctor did not deny it was correct, he just said he does not agree it was deliberate. Talk about mental gymnastics to just avoid admitting the truth. Now, I've got to say well done to Dr. Bruce Scott here. He absolutely smashed it out of the park, using their own bullshit against them, exposing the BBC rather easily because he works in a field directly affected by government policy that they're actually talking about. Or should we say, trying to hide from the public.